My name is Larry Puls. I'm here today for this video with Prisma Health, and I'm a gynecologic oncologist, which means I do women's cancers, mostly pelvic cancers, not breast cancer. I grew up in the little city of Dallas, Texas. I was a Texan for the first 27 years of my life until I started doing all my training. I went to medical school in Dallas, went to residency in Texas, fellowship at the University of Kentucky, and I've been in the Greenville community now since 1994. I love the world of oncology. It affords you several things. Number one, you get to be deeply embedded into people's lives. These are very real problems that these patients have, and so it becomes somewhat of a journey in taking care of them, and you get very involved with their families as well. Second reason is it's a diverse area of medicine because we are both a surgical subspecialty, and yet we do a lot of medicine with chemotherapy and so on. We put both of those things together to do what it is we do for a living. I think the thing I consider to have my largest interest in, and I would love to say my best skill set, would be surgery. I spent a tremendous amount of time there. Have done probably over 15,000 major cases in my career at this point in time, and I still do not tire of the operating room. I would like to think it's a compassionate care. It's not just a job where you show up and you do your job and you walk out, but you really pour yourself into these people's lives and get to know them for who they are and try to tweak medicine so that it fits an individual and what it is they can tolerate and what it is they can do would be how I would describe it. I love being in a large institution for what I do because of the diversity of the practitioners that were in it, because I have to have surgical oncology, medical oncology, cardiology, all these different subspecialties. And to do what it is we do and to do it well, we can't possibly do it in a small institution that doesn't have all these different tracks by which we can get people the care that they need. I consider myself an artist. I have both a ceramic studio, and I do a lot of ceramic work, and I do much of that for nonprofits. And I'm a musician. I've played in a number of bands over the years and still love music and play it often. I think the advice that I give to my patients that I find most valuable is that when they get the diagnosis of cancer, oftentimes people feel defeated before they've even begun the journey. And there's always hope involved in this. And even if there is an ultimate hope in curing the cancer, of which many times we do cure the cancer, people can live very long lives with very productive lives to get to spend time with their family and friends and so on. So I try to give them the advice of be all in, go after this thing. Let's do everything we can. And you never know where it's going to end up, because sometimes you see what look like impossible situations that end up turning out to be really positive situations.